And this is something that's not talked about by general healthcare providers out there. I'm talking about like your doctors, your surgeons, your physical therapists, because their focus is treating you with medications, injections, and surgery. This is why I disagree with some of the highly recommended best back exercises out there. Here's the thing, there's three parts that I've split this up into that is just the trends that I've seen of information that's disregarded or poorly understood, and it has to do with mechanics. I'm going to go into all the details for you. Let me just start with the first point. The biggest thing that I see healthcare professionals at large when treating back pain in order to help avoid a surgery is there is no regard to tissue healing timeframes, which is a principle of healing in the body. Check this out. This is the phases of healing that I've got for the back pain recovery program that I've developed. And I've made this really simple. There's layman terms out there. You could pause the video and check all this out. But basically I divided this into 4 phases, with the first phase here being when you're really, really bad in pain, because you have pain during the day, at night. And there's details that we explain in the program about how to properly classify yourself. But the idea, the general idea that takes into account the phases of healing is that there's certain treatments that you need to be doing in this phase that don't overload your back. Because, for instance, you shouldn't be doing heavy exercise, aggressive exercise, weight room type, gym exercises, cardio type exercises here. Because here you're having trouble standing. You can't even sleep. You can't walk very long. Muscles aren't very active. Then as you get to here, you have to fix certain muscles to get them to become active. Maybe you could do a little bit more, but you still may not be ready for more intense activities. Then as you get into the later phases, you should be doing more intense activities in order to protect the muscle imbalances that you've corrected, more on that in a second, so that you don't end up back here. And this is something that's not talked about by general healthcare providers out there. I'm talking about like your doctors, your surgeons, your physical therapists, because their focus is treating you with medications, injections, and surgery. And yeah, the physical therapists are doing exercise, but they're by and large working with people that have had a surgery, and they're looking to them to to recover from the surgery. They're trying to get mobility back again. They're not trying to fix the root problem. And what I mean by that with physical therapists and exercises, they might have you doing back exercises that actually are feeding into the problem. And if you're irritated right now, happens all the time. We see people that are doing exercises like Supermans, bird dogs, swimmers. They're doing back-focused exercises where the muscles on their back right here are the focus of trying to get the burn here. They're trying to get this stronger, because the general superficial level thinking of healthcare professionals is, if it hurts in this area, work out the muscles in the area. But there's a lack of understanding of how the biomechanics work, of how other areas of the body influence the forces and the pressures in that area of the body. And that, paired with the lack of tissue healing understanding and the phases that I just described to you, is not properly communicated. So what you get as a result is a healthcare professional in person or online telling you things like, oh, you got back pain, you need to do stretches, you need to do knees to chest, twisting stretches, you need to thread the needle, figure 4 stretches. You can look all these exercises up, but those are good to do if you're just in phase 1, if you're just in a lot of pain and trying to calm things down. But if you're looking to fix a root problem, you can't be doing those exercises indefinitely. You have to eventually move on to harder exercises that are focused at fixing the root problem. And that leads me to my next point, is most healthcare professionals out there are thinking about stability. Stability meaning they're trying to keep the spine from moving because they think that it's really fragile. And in some situations it is for a time, because like you can see here on this skeleton, they put a herniated disc that's representing like what a herniated disc would look like, and it would bulge outwards and potentially press on the nerve. And so if you come into a doctor's office or a physical therapist's office and you tell them, I was diagnosed with a herniated disc, my MRI shows that I've got one of these things, immediately some of the thinking of these healthcare professionals is, oh, we don't want to do anything to mess up the disc. So we can't do extension exercises, we can't be too aggressive, we want to just keep you stable and do things like planks, side planks, forward planks, things where you're just holding and working resistance, where like I've seen one where people are holding a rubber band tied to something fixed this way, or maybe like a cable with a handle on it, and they're walking sideways trying to keep their spine straight. And that's not bad. It's not like harmful directly, but without looking at the concept of muscle imbalances, it's not going to fix a root problem. And even more importantly, is it's teaching you as a person to not bend your spine, and it's subconsciously putting a fear in you that you shouldn't be bending. You can't bend over. You have to keep your spine straight and hinge at your hips always. And that's not wrong to learn, but you also need to learn how to move more normally, because you're not always going to be in your house picking up the socks, the laundry that missed the hamper, or the thing that you spilled on the ground that you have to pick up. You're not going to keep a super straight back and squat, Asian style. You have to be able to bend in your spine at some points, and you don't want to be living with the fear of I can't do it. Sure, you're not going to pick up hundreds of pounds in that position, likely. Maybe you will, depending on your skill level, your exercise level, all those things. But I'm talking about the simple things. You spilled some food on the floor, you got to pick it up and sweep it with a dustpan. Simple stuff like that. You got to wipe up something. You have to have the ability to move and not just practice stability movement. So planks are not a good long-term exercise to be doing, in my opinion. Even then, planks are supposed to be an abdominal exercise, and very often they end up working out your shoulders more than anything else, or your hip flexors more than anything else, and you kind of miss using the abdominals. And there's a right way to do planks that can actually be more productive. But you still have to eventually move away from planks and be doing other exercises that are going to focus on fixing the root muscle imbalance. I'll tell you more about that in just a second. The third point I want to make is there's healthcare professionals out there that focus on mobility. They're focusing on stretching, on twisting this way to open up your spine. So they're kind of contradictory in a sense, but what they're not telling you, that I want to be super clear with you here, is that there's a right time for each of these things, and it's not clearly communicated to people with back problems when you should be doing what exercises and when you should stop doing these simple exercises and move on to the harder exercises. That's what I've illustrated for you on that chart. You need to do phase 1 treatments, and then when you get out of phase 1, do phase 2 treatments, and so forth, so that you progress. Because if you had back spasms 2 months ago and you're better now, what you did to fix the back spasms isn't going to get you to feeling tremendous to where you can deadlift again safely. Because deadlifts are okay for you if you work your way up to it. See, there's healthcare professionals out there that'll tell you, don't do deadlifts ever again because that's what messes up your back. What's deadlifts done wrong that mess up your back? It's because you have a muscle imbalance. But actually, you should be able to pick up heavy things from the ground. That's okay. That's actually great for your health. You just have to learn how to do it correctly. So mobility, as far as like stretching and stuff like this, it only needs to be done in the beginning. When you're in phase 1, phase 2 of the back pain recovery chart that I showed you. But by the time you get into later phases, it's not as important. It's not going to hurt you to do that stuff, but it shouldn't be the focus, because that's not going to improve you. To use a different model, like if you're learning how to read, if you think of an elementary age child that's learning how to read, and they're in first grade and they're learning how to put together three letters for a small word like cat, maybe they work up to bigger words. Well, eventually you need to start reading sentences and paragraphs and books that have chapters in them, textbooks. That's how you get to middle school, high school, college level. But if you're stuck reading 3-letter words in 5th grade, in 8th grade, in 12th grade, you're not going to progress in your reading level. Hopefully you get that. It's the same thing with back problems. You should be doing the simple stability, planks, holding your abs in. That's good to start with. But then you got to do it while walking. Then you have to learn how to do that while doing your chores at home, your daily activities, while picking up the groceries, while cooking a meal. It's the same analogy, but what people get stuck in because they're guided this way by healthcare professionals out there that just don't have a clear understanding of the biomechanics, the tissue healing properties, the strength principles involved, the way that it all fits together, is they're stuck doing knees to chest when they should be doing some weightlifting. So this is why there's exercises that are good in some situations, but not good in others. So learning a pelvic tilt, for instance, like I don't really ever call it a pelvic tilt because it confuses people. you're tipping your hips back this way to flatten your back. Some people get all mixed up, healthcare professionals, because they say, well, we're going to hurt the disc. But that needs to happen to get the abs involved, and they don't understand it's not about flattening out your back as much as it is activating your lower abdominals. That's really what you have to be doing when you're doing the pelvic tilt. So why do we even call it a pelvic tilt? I tell people just get your lower abs to fire, because as soon as you do that, the lower abs being in this area right here, you automatically get stability in your pelvis bones, and you get stability in the lower lumbar bones right here, which is where most back problems happen. You get the bottom two discs herniated most often. You get these nerves pinched most often. That's where arthritis happens, and it's because you have a lack of stability. There's a big muscle imbalance. The mechanics are not right because abs aren't doing their job here, and back muscles are overcompensating. They're dominating the stability and movement in the area, and they're crushing the spine back here, setting up arthritis and stenosis. You also have hip flexors here in the front that compensate for weak abdominals because they can. They're in a position to attach to the vertebrae, the bones here of the lower back, and their angle of pull is up and down this way. They attach down here to the thigh bone, and so when they contract, they yank down and compress the spine along with those back muscles back here, and those are the two muscle groups that will compensate for weak abdominals. But when you fire your abdominals properly, it actually tilts your pelvis back, that posterior pelvic tilt, and it offloads the spine. It pulls your rib cage down, which lifts the spine from the top upwards. So it kind of hoists the rib cage up and pulls the pelvis down, and it corrects the mechanics in the spine. And it's that needs to be learned on a low level of do this in bed, turning over, do this while you're standing up, do this while you're walking, do this while you're cooking a meal, and then eventually do it while you're in the gym doing exercises. This is why I disagree with learning bridges without first learning how to fire your lower abs and how to fire your glutes. There's key milestones that you need to figure out, and they're just not taught by general healthcare professionals. And they're doing the best they can with what they know. I've gone through a lot of training. I've worked with the best people in the world. I've pieced together all this stuff through my pathway in healthcare and education to be able to bring this to people. And I've tested it on thousands of patients and millions online that have given us feedback that this stuff works. So if you're out there and you're going to a general doctor, a general surgeon, they're going to offer you medications, injections, and surgery most of the time. If you're going to go to a physical therapist, they're best at helping people after surgery. They're helping people recover from surgery, and they're not going to understand these concepts that I'm talking about. It's just not in their schooling. They have to go through a bunch of extra knowledge, which they don't typically do. It's just not commonly done. But I want to let you know that here on this channel, I can help you out. Go check out our videos, and more importantly, I want you to check out our back pain recovery program. I've outlined everything you need to know step by step in the program, my treatment process for fixing these muscle imbalances that set up serious back conditions like disc herniation, sciatica, stenosis, arthritis, spondylolisthesis. I can go on. You can learn more in the link in the description below. Go check it out.